We're going to get the latest now on Christie Brinkley. She's coming off hip replacement surgery 26 years after being injured in a helicopter crash. Lara back with the details on that. And Lara, this is something you had to deal with a few years back.
Yeah, totally. She didn't want to do it. I can totally relate. I had the same surgery, George, 4 years ago. It's very daunting. But now that Christie Brinkley is on the other side of the operation, she's wondering why she waited so long. This morning, supermodel Christie Brinkley saying you're never too old to get hip. The 66-year-old revealing on Instagram she recently underwent hip replacement surgery, posting, quote, "New year, new hip. Yes, that's a Band-Aid on my hip. I injured it in a backcountry skiing helicopter crash on a mountaintop in Telluride many years ago." Adding that 12 years ago, I was told it needed to be replaced, but the surgery was daunting and I had things to do. I can relate. I, too, had hip replacement surgery after years of competitive athletics and a tennis injury. My surgeon, Dr. P.Su at the Hospital for Special Surgery in New York, also did Brinkley's.
She had an accident where basically the hip was pulled upon, and that probably tore some of the structures and the cartilage in the joint. She was able to maintain herself for years and years and exercise through it. But it got to the point where the cartilage wear was too great. She started experiencing stiffness, limitations of motion, sudden pain that would come on where she almost would feel like the leg couldn't support her. Because of a little bit of downtime during the pandemic, not having her usual schedule, it ended up being a really good time for her to be able to undertake this recovery. She felt comfortable with the hospital, with the protocols we have in place.
And now Brinkley is urging others to take stock, writing, "If you've been putting something off that could improve your well-being, but hesitate out of some sort of fear, I suggest learning as much as you can about the process and the results and expectations."
Her condition was post-traumatic, so she's on the younger side for hip replacement. She's making an incredibly fast recovery.
The mom of 3 saying the operation is already giving her a new lease on life, writing, "I can't tell you how happy I am I have done this. Now I can focus on getting back in shape and rebuilding my strength." That's right, and Christie's doing great. I know Dr. Sue already has her up and moving. I was on a stationary bike with my trainer, Todd, within 1 week of the surgery, and the surgery has come a long way. The incision, as you just saw with Christie, it's like 3 inches. I actually walked myself out of the hospital 24 hours after the replacement. George, it is critical to do the physical therapy and get the joint and the muscles moving as quickly as possible for an optimal recovery.
Yeah, and you did have such a great recovery there, Larry. You did it all the right way. Thanks very much.